Dear students, let us discuss about the pterion. In the discussion on pterion, we will define pterion, learn about its location and shape, bones contributing for the formation of pterion, its anatomical importance and clinical importance. The word pterion is derived from the Greek word pteron, which means wing. In Greek mythology, Hermes, the messenger of gods, was enabled to fly with the winged sandals and wings on his head, attached at a location which is known as pterion. So in this picture, you can see the photograph of Hermes, the messenger of God, who is enabled with winged sandals, you can see in this picture, and wings on his head, which are attached at a location known as the pteron, from which the word pterion is derived. Now, let us define pterion. It's a region on the anterior part of norma lateralis, which you are seeing in the picture, the lateral view of skull, which is known as norma lateralis. And look at the temporal fossa. In the temporal fossa, 4 bones are joined, and that joint gives a shape of letter H. So, pterion is a region on the anterior part of norma lateralis in the temporal fossa, where 4 bones of skull join together in the shape of letter H. So it's an important landmark on the side of skull. It's also known as the Sylvian point. Now let us see what are those 4 bones that are meeting in the form of the letter H. They are the frontal bone, the parietal bone, the greater wing of sphenoid, the squamous temporal bone. Now let us look into the surface marking of location of pterion. It is 4 centimeters above the midpoint of zygomatic arch and 2.5 centimeters behind frontozygomatic suture. It's about 3 fingers above the tragus of ear and 2 fingers behind the frontal bone. That's about the surface marking of location of the pterion. Now let us understand the importance of the pterion. The anatomical importance of pterion is in the fetal and neonatal skull. In between the bones forming the vault of the skull, there will be spaces that are unossified and are joined by fibrous membrane, and such spaces are called the fontanelle. There are the 2 in relation with the vertex and then 4 on the lateral aspect. It is, you will see on the norma lateralis, 2 on each side. So they are the anteroinferior and posterior fontanelle. Pterion is the location for the anteroinferior or sphenoidal fontanelle. This fontanelle closes around 3rd month after birth. Let us focus on the other points of anatomical importance of pterion. The pterion rise over important intracranial structures. They are middle meningeal vein, anterior division of middle meningeal artery, and the stem of lateral cerebral fissure or sylvian fissure. In this picture, you can see the middle meningeal artery, which is a branch of maxillary artery, passing through the foramen spinosum and entering the middle cranial fossa, where it divides into anterior and posterior divisions. The anterior division of middle meningeal artery is in relation with the pterion, and the stem of lateral cerebral fissure or the sylvian fissure is also related to the pterion. Now let us discuss about the clinical importance of pterion. The pterion is the weak point of the skull. So fracture of temporal region that happens in car accidents. That is the importance, because so many structures are related to the pterion, and as we have discussed, the middle meningeal artery, especially its anterior division, is close to the pterion, and whenever there is fracture of temporal region in the region of pterion, it will cause rupture of middle meningeal artery and heavy bleeding results. Subsequent to that, there will be formation of extradural hematoma. In this picture, you can see the sylvian fissure, which contains the middle cerebral artery branches. The sylvian fissure, it starts on the inferior surface of cerebrum in relation to interpeduncular fossa, and where the circle of Willis will be formed in the interpeduncular fossa, and there is submerged part of cerebral cortex within the depths of the sylvian fissure, which we call it as the insular cortex. And you know that in relation with the interpeduncular fossa is the tuber cinereum, and the attachment of stalk of pituitary gland is there. So if there is rupture of middle meningeal artery, there will be heavy bleeding that results in extradural hematoma. So whenever there are pituitary tumors or any of the vascular malformations in relation with circle of Willis, or any of the abnormalities in the interpeduncular fossa that require surgical intervention, a burr hole is drilled through the pterion, so either for ligation of the middle meningeal artery or extradural hematoma in case of traffic accidents with fracture of temporal region. And the pterion is also a neurosurgical landmark for assessing the or for approach to the several important supratentorial structures in the anterior and middle cranial fossa. So the approach of sylvian fissure and basal cisterns that will be placed in the interpeduncular fossa. So it can be due to vascular and neoplastic lesions. For surgical approach, the pterion is the neurosurgical landmark, as in pituitary tumors and vascular tumors of circular Willis or any tumor in the interpeduncular fossa. I hope you have understood about the pterion, its location, shape, bones forming, and the surface marking for it, and its anatomical and clinical importance.